got involved, I got directed towards wanting to do a master's and a PhD in psychology, and I really always thought I would be a clinician and I would just be a psychologist helping people in a room, talking to them. And as I was progressing through graduate school, I realized my passion was really in the research side of it, and really in trying to understand the nuances and the underpinnings of how stress is impacting our biological states, and how physical activity might protect us from the impact that stress has on our body. And I just got more and more excited in terms of like what research was able to provide us in terms of information. And I started getting a little disenchanted with the clinical side, where I just didn't want to be sitting one-on-one helping people in that way. And I wanted to help people with science, and I wanted to discover new things and interventions, and create interventions that might help people and help a larger group of people all at once. I received funding from the NIH, from the NHLBI division, so the National Heart, Lung and Blood Institute, to do this study with Alzheimer's caregivers. So caregivers who are providing care to a family member who has Alzheimer's disease or some other type of dementia-related disorder. And the funding was to support helping inactive, high-stress caregivers to get more active. So we're providing fitness instructors or fitness trainers, fitness coaches, free gym memberships, tracking devices to help them track their physical activity. And we're looking to see whether a 6-month intervention has any impact on their psychological states or their biological states. So looking at immune system aging and looking at other markers of an aging body to see if exercise is protecting them. And the funding from the Alzheimer's Association really adds a very important and unique piece to this research. Every single day for a 7-day period, participants get a questionnaire that asks them questions related to their stress level, their provision of care during the day, their mood, how they're coping with things that are happening on a daily basis. And we just don't send it for 7 days straight, we send it 6 times a day for 7 days straight. And it really gives us more than just a snapshot of what the stressors are in people's lives, but it really gives us an understanding, almost like a film, of what's happening in their daily life experiences. Gives us a much more nuanced understanding of, because it gives us a better understanding of what is happening to these people, because really we talk about caregivers, but things are happening on a daily basis to them. So it's those things that are happening on a daily basis to them that's wearing down their systems and wearing them down psychologically. And if we can see if physical activity can actually shift some of their experiences on a daily basis, not the fact that they're providing care, people do provide care, and that's what, that's what they're doing because they have a family member who has an illness, but really to see whether physical activity can change maybe their emotional states a bit on a daily basis, or their how they cope with some of those stressful events, or how quickly they recover from some of those stressful events emotionally. If we can show that physical activity might shift some of those factors, we might be able to support future intervention research with caregivers specifically. I think one of the most exciting things about being in the caregiver research area is that people are starting to be excited about caregiver research. There has been a lot of research on disease outcomes in the past 20 years, 30 years, and most people focus on the patients who have a disease. And often the caregiver who's providing the help is kind of an afterthought. They're the people who help bring the patient to the hospital for the testing or for the research study. Very less people do the research on the caregivers, but I see that there's a growing interest in caregivers, and I think a big part of it is that the population of caregiving is expanding exponentially. Just 4 years ago, in 2010, 29% of Americans were providing care for a family member who had any type of illness, and now it's 39%. It's increased by 10% in a 4-year period. And it's just going to keep getting worse as the population ages and as the population gets more unhealthy. So I see that there's a lot of space for caregiver research, and there's a lot of space for not just understanding how bad the lives are of caregivers, but what we can do for caregivers to make their lives easier, whether it's an exercise intervention like I'm providing, or whether it's a cognitive behavioral therapy intervention where caregivers learn how to cope a little better with daily experiences of caregiving, or a mindfulness intervention, or nutrition intervention. There are all these different opportunities for making the lives of caregivers better, which ultimately, hopefully, shapes the lives of the patients as well.